I got nervous. I was like, wait a minute. I don't know that I hit the right button.
I just got nervous, and I was making sure that I wasn't supposed to let people in to share their cameras and audio. So I'm glad to see you. Welcome, Shenita.
Thank you for having me.
Welcome, everyone else who's joining slowly. I think we're going to get started in about 2 minutes. I'm looking forward to this session.
Let's see. Hey Jenna, for the sharing, just to make sure I have that right. I don't know that I have that right.
There should be it looks like a computer icon, and right now it should have a red line going through it. And you should have rights to do that. Welcome, Dr. Shin. It's good to see you.
Good morning, Jenna.
For those of you hopping on, we will get started in about a minute. I'm really looking forward to this session. We have a lot of great presentations ahead of us. We'll go ahead and get us started. I'm so excited about this session. It looks like we have 3 great presentations ahead of us. This session is considering context and culture in student support services. The thread we have been going through for this whole conference has been the promise. So this is the promise of student well-being. So we have Shenita Williams presenting When We Do It for the Culture, the intentional centering of Blackness in school-based mental health systems. Shenita is in the VCU School of Education in the Educational Leadership Policy and Justice, and she also works for Henrico County Public Schools. She is a licensed clinical social worker, school social worker, and also a PhD candidate. We have Dr. Sunny Shin and Sara, Abdel-hamid, and Brooke Nuckols from VCU, presenting trauma-informed education to promote productive learning and healthy development. And then we have Gentry Barrett from the University of Nebraska-Lincoln, Martinique Seeley, and 4 other presenters from the University of Nebraska-Lincoln, Emily Wilson, Jungwon Yoon, Jay, and Gwen Nugent. So I'm really excited about this session. To prevent from running out of time, I will go ahead and turn it over to Shenita, and I will let you get us started.
All right. Thank you, Jenna. Now, I may need your assistance to pull this thing up, so we're going to see what happens. Should I be able to see it on my end? No, you're not able. Let me know when you can see. Okay. I wonder if I try entire screen. Nothing. It's not allowing me to. I can click on it, but then when I click share, it X's out my video again. So maybe I need to play around with that, and to not waste time, should we skip me for a bit? I'm not sure what I'm not doing right or wrong.
I am not either. I am so sorry.
Okay, let's go on to the next, and I'll try to figure it out on my end.
Okay, Dr. Shin, is your team ready to present?
Okay, let me see. I am new to this platform too, but
I think we all are, so we will all provide patience. And I like the think alouds. I've been enjoying those in all the sessions so far.
Why don't we try this? I don't know whether people can see the poll that I just created. Can you go to the polls? And the first question that I put up there is, okay. At the bottom, have you heard about the adverse childhood experiences? So if you can go to the polls and scroll down, you will see my question, 3 of them. See if you can answer those, and I'm going to figure out how to share my screen. Okay.
I can see your screen, Dr. Shin. Thank you.
I think I figured that one out. All right. Again, we're going to start with the polls in the poll window on your right side of your screen, probably. If you can scroll down, I put the 3 questions down there. Have you heard about adverse childhood experiences? Do you know what they are? And then finally, I put, what percentage of the population do you think has at least one ACE? I mean, obviously, if you don't know what ACE is, you don't know how to answer it, but you can simply guess it. Okay. So it looks like the majority of us, about 80%, at least heard about what is the adverse childhood experiences. About 70% knows what they are. And then kinds of the how common is this question, 40% saying that, maybe 30%. And another 40% saying maybe 60%. And then 10% saying 90%, 6% saying 10%. Okay, I think that's good enough. Hello, my name is Shin. My co-presenters, Sara and Brooke, are not available. They have class right now. I believe I have like a 15 minutes presentation, and then we're going to have like a discussion Q&A for the rest of the 15 minutes. So let's see. I'm going to try to go and then stop like 11:52, 11:53. Jenna, please stop me if I go over like 11:55. Okay. So this is my group. I want to acknowledge the school and then community partners that we work with. For some people, life is not just good or bad, but it is simply stressful. And I want to make sure that there's a different types of stress. First of all, there's a positive stress. Am I stressful right now? Probably, because I'm using the new presentation format. I supposed to go to number 2, but I was forced to go to the first. So it's a little bit stressful, but at the same time, it's like a very, very meaningful for me to share what I study, what I work with the new people. So that's exciting. So even though it's stressful, I see that one, it's very, very positive. And also there's a stress that it's very tough, but it's tolerable as long as you have supporting families, friends, and colleagues. Death in the family is a good example. It's always tough to lose your loved ones. But as long as you have like a good family and friend support and everything, it's tolerable at least. Excuse me. But I'm talking about something called the toxic stress today. You have parents or family members who have severe drug use problems. You have been physically abused many, many times in your childhood. So we're talking about that toxic stress. And, if you turn on TV, many people talking about in different terms like a trauma, stress, toxic trauma. But some people also call them as like ACEs, adverse childhood experiences. It's basically kinds of the 10 potentially traumatic events happening in childhood. So for example, physical abuse, emotional abuse, sexual abuse, and then neglect, as well as you are living with the family members who has severe mental health problems. You are living in a situation where domestic violence or the intimate partner violence is very, very often. So, these 10 types of ACEs, which is coined by the researchers in San Diego County in 1998, we call them as ACEs. Okay? So for the last 3 decades, we have very solid empirical evidence supporting that ACEs have negative impact on many different domains of public health. So behavioral problems like substance abuse problems. We have lots of information indicating that you have exposure to ACEs, your public health problem will be worsened. And as well as on the physical health as well as mental health. Lots of studies reporting the very strong links between ACEs and depression, suicide attempt. But at the same time, lots of the studies indicating that ACEs increase your vulnerabilities to physical health problems like cancer, heart disease, obesity, diabetes, and stroke. So roughly to say, this is according to the CDC nationwide study reporting that about 61% of adults were exposed to at least one ACE prior to age 18, whereas about a quarter were exposed to 3 or more types of ACEs. ACE study in school and classroom are relatively new, but the number of studies reporting that ACEs are still prevalent in classroom too. This one is coming from the State of Washington State Family Policy Council. They did statewide survey in elementary school all the way up to the high school, and they found that about a third of students in classroom of 30 have 3 or more ACEs. Poor academic performance and mental health problems among students exposed to ACEs are also well documented. This one is coming from the National Survey of Children's Health. So the way that you read this chart is that this is the number of or percentage of students who's answering for this question that do you complete your homework? Always, sometimes. And this is the report of never or rarely. So for example, when you have no A's, about 22% reporting that I rarely or never complete the homework. Whereas when you have the 1 A's, that goes up to 32%. When you have 3 or more ACEs, your answer to that school engagement item goes to 48%. Does not finish tasks started at school. So this is what's happening in classroom or in school. Pretty much the same trend for those students who are reporting no A's. About 25% report that they do not finish tasks started in classroom. Whereas when you have the 1 A's, it goes up to 35%, 2 A's, 43%, 3+ A's, nearly half does not finish tasks started in classroom. And all these studies are controlling for demographic information and other risk factors for academic performance. Grade repetition, you see the same thing. No A's, about 6%. When you have 3 or more A's, it goes to 21%. Finally, household contact because of the problem at school. You see the same trend. We call this one as the dose response effect. The more exposures you have to ACEs, the more likely to you have the academic or the school problems. Same for the behavioral problem, like the youth alcohol use. So this is the way that you read it compared to those people who have no exposure to ACEs. When you expose to 1 ACE, your chances of alcohol use in adolescence goes up 1.5 times. If you have 2 ACEs, it goes up 2.4 times. If you have 4 or more ACEs, your chance of, it's not frequency, by the way, as you can see bottom there, it's the regular alcohol use. It goes up to 6.2 times. So the big question is this, why that's happening, right? Why students exposed to ACEs perform poorly academically in school as well as behaviorally. So very simple answers is that the ACEs change your body, mind, and community. But what I want to emphasize today is the healing is still possible. So I'm going to go over this one very quickly, but according to the eco-biodevelopmental model of health and disease, excuse me, ACE is simply not about, temporary issue. That events happening in childhood totally alters your biology. I'm going to show you some examples. And then transactions between you and your context, surroundings, cultures, ecology, and biology drive your overall development. That's what this eco-bio developmental model talks about in terms of the human development. So here we go. So this is the ecology. Somehow you are exposed to ACEs. And there's a epigenetic transactions happening which result in biological changes. So there's a lot of studies how trauma in childhood alter your stress response systems. It disrupts your brain development. And you're going to live with that biology throughout your life. And that will change your school performance. So this is the 2004 study, which is comparing the neuron connections in prefrontal cortex and hippocampus between normal child and a child exposed to ACEs. You can vividly see that the connections are fewer with the kids with ACEs, and those neurons has really damaged if you compare those two. This is the very beginning of the neuroscience and trauma and brain development. If you see more recent studies, the contrast is the more apparent. So then what we can do to create a trauma-informed school, trauma-informed classroom. I do believe in the impact or the power of the social emotional learning. Obviously, it is very important to equip them with the emotional ability, self-regulation, teach them what is healthy relationship. And then, I see that the substance abuse problem, vaping and everything, very important, and provide them a preventive tools. And then, of course, for those kids exposed to ACEs, you gotta address those trauma issues in school and community. I have about 4 minutes. One program that I want to share with you today is the one that VCU has developed last 5 years. It's called the Rise Above, Building Life Skills to Overcome and Thrive. And this is the for kinds of the adolescent population, middle school, high school, 11 to 18. It's like a small group activity program. Youth group in the 6 to 8 youth in one group. It lasts about 50 minutes per session, and entire session is about 20 sessions. I'm going to skip how we develop the program and everything, but the program is very much student-centered curriculum. So as you can expect, lots of the interactive activity. We intentionally put lots of the game-based tasks and lots of stories, real-life stories that you can find in middle school and high schools. I believe the Rise Above is the one of the first trauma-informed social emotional learning programs, because according to that CDC study, about 60% reporting at least one ACE. We see that the ACE is very prevalent in classroom. So it's not just for those children with the severe trauma exposures, and we see that it's very important to teach them how stress and how trauma influence their brain, mental health, and academic performance. That's what we do, and we use the lots of the mindfulness-based activity to help them ease those acute and the potentially chronic impacts from the ACEs. We offer this program in person as well as online, and that was the perfect timing for the under the COVID-19 situation. It comes with the 4 different units: the living a drug-free life, mastering your thoughts and feelings. This is the place that we teach them, emotion. We teach them the how they can change their thinking process. Boosting your greatest inner strength. This is the place that we teach them emotional self-control, behavioral self-control, and finally, building healthy relationship. Very simply, we did RCT on this one. And this is the one classroom that we did in Charlottesville last spring. You see that the one, this poor guy, his like family is separating at that time, and his mental health issues goes up between pre and post test. But you can see that the all other kids, their mental health problems or the conditions goes down from the pre-test, post-test. They report that their emotional self-regulation increased from pre to post-test. Especially, we were able to see that their sadness control skills kinds of improved a lot within those 20 sessions. Same for the behavioral self-regulation. They report that they are able to refuse if there's any offer for alcohol and drug. And same thing for the prescription and heart drug too. You can visit the riseabovenow.org, or you can email me. I can send you more, program and the program results. And I thank you for attending this session. It's about 11:53. I think it went well, even though it was totally new platform for me. Let me stop here so we can have a Q&A and discussion.
Thank you so much, Dr. Shin. That program looks really exciting, and I look forward to seeing what comes next with it. Shenita, are you able to share now, or do you want me to share your slides?
Okay, so I'm looking at Dr. Oh, there it is. All right, so let me try again. And I think in between you and maybe someone else, I might be able to get this. Okay, so I'm trying to share a PowerPoint. But maybe Jenna, if you could do it on your end, that might take some of this. Whenever I click on something, it's as if my computer just isn't allowing it. Well, let me see. Maybe I can do. How about this? Oh, y'all don't want to see that. How about this? Are you able to see that?
I can see pictures. It looks like you're showing your drive.
Oh, yeah, it's not working. Can you try Jenna for me? Let me see. How do I stop sharing? There we go. And can you just do it in well,
Is that good?
Yeah, that's good, but it has the notes. So if you can adjust that for me, that'd be great on your end. If not, we're just gonna. Perfect.
Can you see that now?
Yeah, that's good.
Okay, good.
Thank you. Alrighty, so I'm trying to navigate.
So I think if we go until about 11, I'm trying to figure out the time, 12,
okay,
15.
All right, you just call time. Thank you all for being patient with me. Good afternoon. I am Shenita Williams, and I am a school social worker with Henrico County Public Schools, and also a PhD candidate in VCU School of Education, Educational Leadership, Policy, and Justice track. I'm excited to be here with you to talk about my research, which focuses on school-based mental health systems, what they need in order to adequately meet the mental health challenges of Black students. It is my hopes that my research will highlight the importance of understanding the cultural, contextual experiences and unique cultural factors of Black students with mental health challenges. So for our time today, I'll spend a few minutes first talking about schools as providers of mental health, and then I'll share some themes from the literature, and I'll talk about the use of an African-centered approach to address the mental health needs of Black students, and then I'll conclude with some final thoughts. Next slide, Jenna. All righty. So what the research tells us is that students are 21 more times likely to receive school mental health services from a school rather than a community clinic, and that schools are in essence providing 70 to 80% of the mental health services and supports that students are receiving. So schools are in essence the mental health care providers of choice, whether they want to be or not. Schools are also natural settings for the provision of mental health services and supports, due in large part to the amount of time that students are spending at school, right? And so having school-based professionals in the building who are able to meet directly with students, addressing their direct needs, is helpful. And it allows for those professionals to connect students with community agencies if their needs are greater than what the school is able to provide. And so the definition of school-based mental health is pretty consistent across the literature. It's typically thought of as programs or services that a school implements to address the psychological, behavioral, or emotional problems that a student may exhibit. However, what we often see are school districts that provide fragmented programs, interventions, and services. And so we really should be thinking about comprehensive school mental health systems that are, by design, implementation, and evaluation, more adequately meeting the mental health needs of students across all levels of need. Next slide, Jen. All right, so I specifically focused on literature that's centered around the mental health needs of Black students within the context of school settings. And the following themes emerged. First, there were barriers to mental health services. Next. There are biases of educators. And then the last theme was this intersection of class and mental health and culture and mental health. Next slide. So typically when we think of barriers to services, we think of transportation, insurance or lack thereof. We think of access to community mental health services, or again, a lack of access. The stigma of mental health, a lack of information. What we don't think about or talk about are the other barriers that are tied to race, culture, and ethnicity. These barriers include a history of distrust in the system overall, but we're talking about distrust in mental health systems and distrust in the educational system. Additionally, our students are facing as barriers racism and discrimination, not just in the society at large, but in their communities and also within our school buildings and our classrooms. Additional barriers are a lack of racially and ethnically diverse mental health professionals. There's a lack of understanding of the lived experiences of Black families, and mental health professionals often lack this awareness of how to work with diverse groups. So all of these barriers to mental health services for Black students contribute to the underutilization of mental health services by Black students. Next slide. In a 2015 study, Black parents of elementary students participating in school-based mental health services, they reported concerns about how or the process that was being used to diagnose their children. Research has shown us that Black caregivers are often not included in decision-making about mental health services for their children. They often feel alienated or powerless and uninformed about specific processes. In a 2010 survey using a white observer and a Latinx observer, the symptoms of depression and anxiety that Black students experience were viewed as much more extreme than white students. Yet when students were asked to self-rate their depression and anxiety, there was no difference between how Black and white students rated themselves. In comparison to white students, Black students may be inaccurately identified as having anger issues or behavior issues when displaying externalizing behaviors such as irritability, frustration, anger, and often these symptoms are often associated with depression in adolescence. In many cases, the interpretation and addressing of externalizing behaviors is detrimental to Black youth, and it creates pathways to juvenile justice systems, the special education, and even involvement in Department of Social Services. So the mental health of Black students is affected by teacher perceptions and responses, and these perceptions of and responses to the behaviors of Black students is moderated by race. When educators focus solely on behavior without considering possible underlying factors, including their own biases, they are likely to over-identify Black students for services such as special education. Next slide. People who live in poverty are more vulnerable and susceptible to experiencing mental health challenges than those who do not. According to the 2011 U.S. Census Bureau, 14 million youth under the age of 18 were living in poverty, and those youth were almost 2.5 times likely to be Black. Not receiving mental health services when needed is a concern for youth who are in the low socioeconomic status. In 2011, it was also reported that upwards of 80% of youth who identified as living in low poverty or low socioeconomic status who were in need of services had not received any services in the year preceding. Black youth, in comparison to any other group, are more likely to be exposed to ecological factors, such as living in segregated communities with limited access to resources, which can directly impact their psychosocial development. Next slide, please. While all adolescents, regardless of race, experience many of the same stressors, Black adolescents are experiencing additional stressors, such as race-related stress. Black students are confronted with racialized and culture-specific issues that are judged against the norm of white culture. Discriminatory experiences of Black students impact conduct and mental health. So this means that Black students are vulnerable to the biases and stereotypes that others have about their behaviors. The significance in this is that these biases and stereotypes often determine if and how the mental health needs of Black students will be addressed. Furthermore, a disregard for the contextual and cultural experiences of Black students maintains the existing systems that often mislabel, misdiagnose, and misinterpret the behavior of Black students with mental health needs. Next slide. So it's important for everyone to know that based on the literature, the rate of mental illness among Black adolescents is no higher than that of the national average, nor of any other racial or ethnic group. However, Black children are over-identified for behavior issues at school and under-identified for mental health concerns. So I'd like to share with you how adopting an Afrocentric worldview when working with Black students or students of African descent can be effective in meeting the mental health needs of Black students. I want to say two things though. One, you do not need to be Black to adopt an Afrocentric worldview. It's about the services that are provided to the student and not the personal beliefs or thoughts of the provider themselves. And the other thing is that within persons of African descent, we are not a monolithic group. So we are uniquely cultured within that. So I do want to throw that out there. Next slide. So Afrocentricity is a way of thinking, acting, and living to advance social justice and human rights that honors cultural uniqueness, personal strengths, and community development. It places at the center of any analysis that involves African culture, that involves any African culture and behavior. So scholars of Afrocentricity really believe that the continued use of Eurocentric theories as the dominant explanation and understanding of behaviors of persons of African descent is ineffective, inappropriate, and dismissive of cultural differences. Research suggests that this is actually one of the causes of underutilization of mental health services by Black students, in that the selected programs and services are not designed nor implemented with the Black student in mind. Research has shown that programs and services for Black students are more effective when Afrocultural theories are used. So I'll talk now about, walk you through the using an African-centered approach to address the mental health of Black students. So something that can be done easily in schools. Next slide. So first, the principle that we have here is fundamental goodness of people. We must uphold the belief that all people possess and have a vast capacity for goodness. Next slide. Afrocentricity encourages individual and collective functioning. In Western civilization, individuals tend to believe that the problems that are faced by their neighbors or their extended family, communities are not their problems. However, this principle says that the individual's problems are that of the communities and vice versa. In African culture, the belief is that the individual is a reflection of their community. Next slide. Under the principle of communalism, the family and community have equal importance. They are viewed as essential and necessary stakeholders in the development of Black students. So it's necessary to include families and communities as a part of the educational conversation. This really equates to supporting the overall well-being of the student and their family and the community. Next slide. It is important to understand the role that spirituality plays within the Black community. Spirituality and religious participation are often used as coping mechanisms. Additionally, studies have linked spirituality and religion with African American psychological well-being. Next. Practicing within the principle of interdependency or interconnectedness means understanding the connection of people to systems. The success of the Black student is connected to the success of the systems within their environment, and this includes schools. So in essence, if the individual is well, then all other connected systems should be well. So commitment and action, and this is what I would offer as takeaways or recommendations for you all today. First, we must be vocal about the marginalization and oppression of Black students, but first we have to believe that Black students are worth fighting for. We have to be committed in action to disrupting educational practices, policies, and procedures that perpetuate this deficit thinking about our Black students, families, and communities. Next. We have to know our Black community, the physical community. This means knowing the community problems, but also knowing its strengths. We talk about community engagement, but many educators never step foot in the community in which their schools serve. And we need to include Black families and communities into decisions that directly and indirectly affect Black student success. Next slide. We need to acknowledge the Black students, family, and community as sources of knowledge. They know what learning environment and or interventions best help to improve their child's academic and behavior progress, but we oftentimes dismiss this and we don't welcome the knowledge or information that they have to share with us. Building community partnerships is key to help alleviate student stress by linking them with programs that promote positive educational and mental health outcomes. And then we must, when we're conducting student assessments and interventions to help our Black students better manage life challenges, we should be asking the question about spirituality, what it means to them, knowing that spirituality may be tied to their sense of self, meaning, and purpose. And lastly, students, teachers, families, community members should all be working together to address barriers to educational development for Black students, because we understand that these systems cannot operate effectively if done so independently of one another. And so just something I'll leave you with as a thought before I do my last slide is, which guiding principle resonates with you in such a way that you can see yourself immediately using it in your interactions with Black students? And so in closing, I'll share just 6 things with you. First, Afrocentricity seeks agency, which is built on mental, physical, social, spiritual well-being and action. It can be used in practice, policy, and research. More research is needed, and persons of color, Black folk, need to give ourselves permission and those other people of color to do work that centers us, centers around marginalized groups, oppressed groups, without having to feel apologetic about doing so. Next, we must rethink school-based mental health to be a much more comprehensive system. One division adopted program or a rollout of an initiative does not make a comprehensive mental health system. Next, context is important and culture recognition is essential. And we must recognize and acknowledge the impact of culture in our work with Black students and the biases and stereotypes that many are judged against. Behavior that is seen as aggressive, for example, and how it's interpreted in schools and what that means. And the last point, school-based interventions, programs, and service must be culturally appropriate to be effective. This may require adaptations of models that are not explicitly accounted for in terms of race or ethnicity. In essence, evidence-based does not mean evidence-based for all. And so I would leave you all with those final thoughts. And thank you for today.
Shenita, thank you so much. And it looks like I will now turn it over to Gentry Barrett. And
Hi.
can
you hear me?
Yes, I can.
Hi, yes. So I'll be presenting or speaking today. Gentry's assisting me sharing the screen. But the last two presentations were just so informative to hear about contextual work. So it's really great to be in this session. Like I said, hello, my name is Martinique Seeley. I'm a third-year doctoral student at Virginia Commonwealth University with Dr. Kathy Rudisil, and I'm here today with my colleagues at University Nebraska-Lincoln, Gentry Barrett, Emily Wilson, Dr. Jungwon Yoon, Yun Young Jae, and Dr. Gwen Nugent. So when the schools in Nebraska shut down in March of 2020, many rural elementary schools required students to participate virtually. So that's the topic of this study. Something had to go, and it was schoolwork. So we're thinking to put a poll in the chat for the current participants, but thinking about, were you virtual, in person, or hybrid during quarantine of the pandemic? These parents were mostly had virtual schooling. What we will present to you today are the results of a qualitative study we conducted. We interviewed parents of these rural elementary students about their experiences during the COVID-19 school shutdowns in the spring of 2020. So 2 research questions guided this study. The first question, how did rural families respond to the COVID-19 pandemic shutdown of March 2020 until May 2020 and into the summer and fall of 2020? And the second question, what parenting strategies did families use during the COVID-19 pandemic shutdown? So as I kind of briefly mentioned, our sample had 22 mothers. They had kindergarten, first grade, and second grade children, all enrolled in rural Nebraskan schools. So these are their perspectives and views. The parents were recruited from a larger sample of participants in the Insights Nebraska intervention study, but this sample includes both treatment and control groups of parents. And the age range of these parents were between 28 and 44 years old. They were predominantly white. 26% were eligible for free or reduced lunch prices. 62% were employed full-time. 19% did not work, and 17% worked part-time. So within the study, the method we used, we conducted 9 interviews, some individual and some group, in the spring of 2021. These interviews were conducted and initially transcribed by Zoom. We then edited the transcripts for errors and changed all names to pseudonyms. We asked participants questions like, what stressors did your families face during the shutdown? What parenting strategies did you use? And what resources do you have or wish you had during this time? The interview transcripts were then coded by our team with training and qualitative research. And we used Saldana's techniques for the thematic analysis. So our coding process included developing structural codes after initial review of transcripts, identifying themes after initial coding had taken place, and then verifying those codes through discussions and iterated reliability analysis. What we will present next are the 4 themes that emerged from the data. We found that the challenges participants described fell into 3 categories, and the remainder of this presentation will describe the challenges faced by families and the resilience and resources with which they responded. So you see our 4 themes: educational challenges, work challenges, social-emotional challenges, and resilience, and we'll go into each of those further. First, we will describe the educational challenges faced by families during the COVID-19 school shutdowns. And overall, we found that during the spring shutdown, parents had a difficult time getting their children to complete schoolwork, supporting kids with different educational needs, and found the dual role of teacher and parenting frustrating. So the following slides will feature a key takeaway from our data, as well as several quotes by the parents. So our first key takeaway: parents found it difficult to juggle their children's diverse virtual learning schedules and monitor their children's behavior. All our participants had multiple children, and so they had to keep track of multiple Zoom schedules, find room in their homes for everyone to have a quiet space to work, and monitor their children to make sure they were listening to their teachers and completing their assignments. One parent said, I think one of the biggest stressors was dealing with 3 kids on Zoom calls, and we live in a small house, and so trying to find areas for each child to work and not distract the other ones. I mean, as I think back, that was really hard. And then finding the schedules to coordinate everything and remember who was Zooming when. Parents also struggled with getting their young children to pay attention or stay at their computers and the amount of schoolwork that was being assigned. Another parent commented, I mean, he couldn't just sit and he just didn't want to do online schoolwork, you know. You had to kind of sit with him and have him do it. So none of my kids really wanted to. I mean, they sometimes would do what they were supposed to. In addition to trying to get their kids to do the assigned schoolwork, parents also found it frustrating trying to be their child's teacher and parent. One parent talked about how it was obvious that her daughter struggled with the dual role as well. My daughter struggles already. She's a little behind already when she was in kindergarten. Every time I would try to teach her something and she would get frustrated. I'm her mom, and so I'm not the teacher who's going to remain calm. I'm the mom who is eventually going to freak out because she's upset. Now I'm upset, and it's just a giant mess. And then we get behind on what we were supposed to be doing, so we just stopped. Other parents felt like they were not receiving support from the school around their child's coursework. I basically felt like I had to become a kindergarten teacher overnight. So for me, I felt almost abandoned because we would get the assignment and then there'd be no follow-up. And so I felt like, oh, I have to learn how to be a kindergarten teacher and do these assignments. Educational challenges were difficult enough for parents, but the majority of parents were also working full-time during the pandemic shutdown. So next challenge we'll be describing is those work challenges. Parents faced sudden transition in work and home life. Parents who worked from home described challenges related to managing the demands of their jobs, schooling children, and childcare simultaneously. Parents faced increased demands on time and energy by having to also work at home during school shutdown. One parent reported that just the increased amount of housework from having everyone home all day seemed overwhelming, given everything else she was trying to do. The overwhelming thing for me was trying to do my full-time job while doing all the other things. I'm not used to cooking breakfast, lunch, dinner, and 2 snacks during the day and cleaning up after them. Another parent felt tremendous pressure to maintain professional standards while at home, which was impossible. Just the constant pressure to maintain professionalism in an environment that doesn't really allow you to, your personal life and your professional life just start colliding. And it was really, really challenging to keep those two things, to have the integrity of both things. I felt like I was just massively failing at everything. So this mounting of stress was felt by both parents and kids. So many of our parent participants reported that social emotional challenges were a big part of the stress they felt during the shutdown. Overall, parents described numerous social emotional challenges for themselves and their children, including anxiety about the pandemic, stressors from school and work, relationship strain, and social isolation. The mounting demands of being a parent, teacher, and employee created a strain on the parent-child relationship. One parent described how difficult it was, especially at the beginning, to have work meetings while her kids were at home with her. I guess it's pretty normal now, but at the beginning, having a Zoom meeting and my kids screaming right next to my chair, that was rough. I felt really bad. I was like, you can't do that. And just trying to control their behavior. Well, for that 1 hour every once in a while. Yeah, that was the hardest part, is giving our family a little bit of grace that, it's not going to be a perfect meeting every time, and letting go of that illusion of working from home is way different than working here in my office. One parent discussed how the dual role of being a parent and teacher was so difficult for her relationship with her daughter, and teaching her daughter took so much time. So things that she wouldn't necessarily argue about doing in class, she'd be arguing with me about. We had a fight every day, and that would take half of my day, when at the time, thankfully, I wasn't working full time. And I don't know how people who have jobs full time are doing this. I have no idea. Parents also noticed that their children were struggling with the isolation of the shutdown, but didn't feel like they could really do anything about it. Parents reported that children struggled with anxiety and lack of social engagement during the school shutdown. One parent talked about how immature her son's social skills were, and they couldn't do anything to really help. I think it's been really difficult to build new relationships. We couldn't really help him develop those social skills. We couldn't reach out to people and say, let's have a play date. We couldn't do that, and we're still kind of struggling with that a little bit. Parents saw how hard it was for their kids to be away from their school friends. She did really suffer from the social aspect of things because she's a hyper social butterfly. All of our participants, like we said, had multiple children at home, which helped with the social issue. However, families being home together all day increased the strain between siblings. And one parent said, oh yeah, I have a 9-year-old, a 7-year-old, a 5-year-old, and a 3-year-old. So we were all there, all in school, and yeah, fighting all the time. With the mounting strain of trying to help kids with their schoolwork, trying to work from home, dealing with having to isolate their kids from friends, but having a constant breakup fighting between siblings, families hit a breaking point and parents reprioritized. One parent described how her emotional buildup and how difficult it was. Oh yeah, I cried every day. Once families hit their breaking point, parents decided that they needed to redefine what success during this time was going to look like. One parent summed up with this: I'm a really structured person, and I know I tried to keep them on schedule and stay organized, but like after a while, it became more of a, you guys know what we're supposed to be doing. Let's try to get as much done as we can. If it doesn't work out, we tried. For most parents, schoolwork was reduced to prioritize the parent-child relationship and well-being. One parent described how she cut schoolwork down to the bare minimum because it all became too much. Educationally, my children suffered. It was like pulling teeth to get her to do some of the assignments. And one day, I just threw my hands up and I'm like, we're done. You're learning everyday living things. We'll go outside. I'm done trying to get her on the computer to do her activities and whatnot. It was causing her stress. It was causing me stress. I was becoming the mean mom because I was fighting to try to get her to do her work. It wasn't worth it anymore. So we just kind of stopped. I tried to read books with her to do some educational activities that she wouldn't know they were educational and just kind of hope for the best. Another parent expressed the same sentiment, that they knew that their child could possibly be educationally behind when they went back to school, but their current situation demanded change. We're going to do the worksheets that she sends us once a week, and hopefully we'll catch up in this fall. We butt heads, William and I do. And so I had to take a step back and be like, this is a huge change for everybody. Like, I am stressed. He knows that I'm stressed. So that pushes him up. And I was super stressful until I stepped back and was like, okay, bare minimum. We're going to read for half an hour and we're going to do your math. End of story. That's all we're going to do. So finally, during this difficult period, parents and children had to show a lot of resilience. In response to the rapid increase in novel challenges due to the pandemic and school shutdown, parents used adaptive strategies to mitigate the effects of pandemic-related stressors. For example, parents were able to use social-emotional skills to help their children with anxiety and frustration. One parent reported, one of the biggest things that I learned was affirming my child's feelings as we're going through things. My kid, his feelings got a lot bigger with the pandemic. And so just recognizing that and acknowledging with him really seemed to make a big difference in how he responded in life in general. Parents also implemented creative parenting strategies to deal with novel challenges. One parent talked about how they used their backyard to deal with stress. I always garden, but this last year I made the garden bigger and the children helped with, the dimensions of the garden, getting the earth ready, digging up the trenches for the potatoes. They spent more time in the garden. So with every stress, we had to find a positive to survive. In addition to all the stress the pandemic brought, parents also reported unexpected benefits to the shutdown, mainly time together as families. One parent noted, honestly, COVID, this was our best summer of our family. We love all being together all the time. Another parent talked about how being forced to stay home really allowed everyone to reset. That break of the go, 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 go was really good. Our whole family got a reset, and now we play with our kids more than we ever did because we broke the cycle of all the things that we've had to get done. In conclusion, we have 3 takeaways from our results. First, there was a mismatch between what school districts were asking parents to do and what parents felt they were able to accomplish, given the constraints of multiple children at home, parents' employment, and just all the stressors in their life. Next, juggling multiple roles as parent, teacher, and worker put strain on family relationships. Parents responded to this by prioritizing family interconnectedness and emotional well-being during the pandemic and school shutdown. And third, social emotional knowledge assisted parents as they supported their children's emotional and behavioral regulation during the COVID-19 shutdown. So, yes, our promise to education in line with Merck's focus, we add this idea. Facing increased demands during the COVID-19 shutdown, families demonstrated resilience and flexibility in managing social, emotional, economic, and family stress. Because of these contextual effects on students' lives, it is essential that the classroom is compatible for diverse student populations, either in person, virtual, or hybrid. Finally, this unprecedented situation also gives educators an opportunity to imagine expanded possibilities for practices in public education. Thank you for your time today. And quickly, we want to thank our funding source, the Institute of Education Science, U.S. Department of Education. And we would also like to acknowledge our wonderful research team at UNL, at VCU, for Merck for having us. And we listed our participants here. Thank you very much for your time today. It's great to talk about this.
I have enjoyed all three of these sessions so much. And I apologize. Technology is never perfect, and so we are close on time, but if there are any questions, we have just a minute left, and I would love to hear any questions. I've been looking through the chat. I saw lots of praise and support of how important this work is. I don't see any questions. Well, I would just like to say thank you. Oh, you see one?
I think Gentry was saying something, but I couldn't hear her.
I can't hear you either. Well, I thank all three of our presenters today. I know I personally have learned so much and value the work that is being done to understand both what has happened over the last couple of years with COVID and what can continue to happen, being trauma-informed and seeking out the specific cultural and important things going on with our parents and with our students. And so I appreciate all three of these presentations, and I hope that you guys enjoy the rest of your day at the Merck Conference.
Can you hear me now?
Yes.
Sorry, just had to change my settings. So Shenita, I don't know if you saw, can we like stay here for a second and can I pick your brain?
I mean, I can stay. I mean, I don't know, Jen is I'm not the moderator. Jen is the moderator.
I'm fine with it.
So I misspelled chronic in the chat, but I'm wondering, as you were presenting about racism and this idea of chronic ACEs that we heard Dr. Shin talk about, I'm wondering if you think that racism falls under this chronic ACE idea.
So when I think about the work that Dr. Shin's team has done, and my experience with ACEs and what I'm looking at, then I would say yes, because it's kind of like how I even talked about racism being a barrier to services that we don't think about. an idea of discrimination being a barrier that we don't think about, we don't talk about it, but it's real. So I would say yes, but Gentry, for me, that's a loaded question because I have some thoughts on ACEs overall, and maybe you and I could, maybe you and I should talk about that off air. But yeah, I think that the work that you all did, like just hearing the voices of parents, right? I started thinking, and I don't know if I missed this part or not, but I started thinking about what was the context for those parents who were working, the specific, I was interested in the demographics, what did that mean? The area in Nebraska where they lived, right? All of those things kind of were flooded in my mind, but yeah.
Yeah, I don't know if I could share a bit more, but yeah, I know a lot of the parents were from very rural areas. So I know that was very different, at least from my context in Richmond, Virginia. So it was interesting to learn about, that separation, the social distancing, how that was kind of, I think, hyper because of the already existing social distance in rural settings. But majority white parents, moms especially, responding here. So, and having multiple children, it was just interesting to hear, how they felt about it. But it was just interesting to hear just a different context for me as well, and to just constantly learn about a new context.
Yeah. Thank you for sharing that.
Thank you as well.
And Jenna, shout out to you for saving the day, because I could not get this thing on my end to work. I don't know what I was doing wrong. You're muted, Jenna.
I'm glad that it worked in the end, and I'm really, really thankful for all of these presentations. I was surprised at how well they ended up going together. So really great job, and I am going to go ahead and close out this session.
Sounds good. Y'all have a good one.
Thank you. You too.